Hello and a good morning from New York. My name is Bart van Ark and I'm Chief Economist at the Conference Board, and welcome to our monthly virtual panel at the Conference Board, Window On, which for the third time in 3 months is going to focus on the COVID-19 crisis that we're currently right in the middle of. Today with a focus on how to reboot a 6-foot economy. I'm going to have a great panel today to discuss various aspects of reopening the economy, and I will introduce them to you in a minute. First of all, just in addition to the guidelines that you just received in the opening video, some of you will be also eligible for CPE credits in this webcast. If you are, then please type your full name and email address in the space provided. Click OK for free pop-ups that will occur during the webcast. Stay online for the entire program, and of course credit is only available for participation in the live webcast only. And again, just emphasize, we encourage you to ask questions. We have a lot of people on our program today. We may not be able to deal with all your questions today, but please pull them in and we can make a good selection so that you can really actively participate in this webcast. As I said, this is our third panel on the COVID-19 crisis. In February, we talked about the implications of what at that time was largely an event in China with some spreading around Asia. Last month, end of March, we were right in the middle of the global pandemic storm. And today, hopefully, we may be passing the first peak in terms of new cases in this pandemic as we continue to see a moderation and perhaps even a slight decline in the number of new cases being added on a daily basis. As we hope that different degrees of physical or social distancing, which range from advice to keep that distance, to shelter at home, to complete lockdowns, we hope that will have helped to flatten the curve, that it will have helped to limit.
Thanks, Bart. Happy to be on.
the human toll in this first round of the pandemic. But it also has done huge damage already to our local economies, the national economy, and also to our global economy. So it's not more than logical. It's even imperative that we need to reopen the economy in a responsible way. And by responsible, we will mean that we need to avoid new large peaks in COVID-19 cases emerging in the coming months, or perhaps even in the coming years. And that will probably mean, as the title of this panel discussion today suggests, that we need to create.
Thank you, Bart. Happy to be here.
A 6-foot economy, or in your calling it from Europe, a 1.5 meter economy, which will be here for some time to come. I hope that in this webcast we're going to learn from 4 practitioners with very different backgrounds, coming from epidemiology, retail, the healthcare industry, the legal and the policy side, to really approach the key questions that we need to discuss. So we'll start this discussion today with basically starting about discussing the current state of business in the COVID-19 crisis, and that discussion will be kicked off by Matt Sable. Matt Sable is the Senior Vice President, Enterprise Risk at Target. Before joining Target in 2010, he served as Chief of Staff to U.S. Senator John Thune. He previously also served at the U.S. Department of Justice in Washington, D.C. in various roles. Matt, it's great to have you on here and be part of our discussion today. In the second section, we're going to really talk about the sort of conditions. What does it mean? What do we need to do in order to basically get safely out of our homes again? So this is really more of a medical discussion, what it is, what kind of precautionary measures do we need to take, and how should businesses respond to that. And for that, we're going to be kicked off by Dr. Wafa El-Sadar. Dr. El-Sadar is the founder and director of ICAP at Columbia University. She's a university professor of epidemiology and medicine, and she is a Matilda Grimm Emfer Professor of Global Health at Columbia University.
Thank you for the opportunity. I think this is probably where most people feel.
And she's deeply involved in designing and implementing programs in public health, on research, education, training, and practice in more than 30 countries out of the world. Dr. El-Sadar, I know you have a very busy program. You'll be in high demand, so we much appreciate your presence here today. We will then focus in the third section today on prioritizing sectors and businesses to reopen. As you know, there's a lot of discussion ongoing about that. What is the strategy to do this? What sectors should we prioritize? How do we anticipate and navigate the local and the state and the federal regulatory maze that we may perhaps be seeing? And here we're going to benefit from the presence on today's call from Ron Klein. Ron is a partner at Holland and Knight and a former congressman representing Florida's 22nd Congressional District, where he served 2 terms with a lot of focus on business development, health, and energy issues. Ron is also a trustee of the Committee for Economic Development, our public policy arm at the Conference Board. Ron, thank you for joining us and supporting us in all the work we're doing here at CED and the Conference Board. And in the final part of our discussion, we're going to really look forward. We try to look beyond the COVID-19 crisis. And as I said, that crisis may be with us quite a while. But as business leaders, we want to look forward, we want to prepare for the future. We also want to make sure that we can avoid a longer-term slowdown which could potentially emerge from this crisis. So once the 6-foot economy is relaxed, what will change? How can businesses thrive? How do we optimize innovation and creativity and inventiveness of people in our businesses? And in that discussion, that will be led by George Barrett. George is a former chairman and CEO of Cardinal Health, a role that he has held since 2009 until 2017, and then until 2018 as executive chairman. George is also on the boards of Target Corporation, Nations Children's Hospital, Brown University, and Children's Hospital Solutions for Patient Safety. He's a vice chair of our board of trustees at the Conference Board and a trustee at the Committee for Economic Development. George, also thank you so much for supporting us in this webcast and all the work that we do. Okay, well, with those introductions and a great panel, let's maximize our time. Before we go into the details, we have, as always, a couple of poll questions, and we're going to put up the first poll question right away for you to answer. And this question is really about what is your view, what is best summarized as your view on opening up the economy for business? Of course, there are many different variations, so pick the one that you're most comfortable with. Do you want to open it up as much as possible and as soon as possible with voluntary physical distancing in place? Do you want it open up as much as possible and as soon as possible with mandatory physical distancing in place?
Yeah, it has been interesting to watch retail, and obviously no industry has been untouched by this, but I think retail has been in the news a lot lately. It's something
want to open it up in a measured and regulated way with voluntary distancing in place. You want to open it up in a measured and regulated way with mandatory physical.
Retail has always been a challenging industry. I mean, it's an industry with thin margins. It's highly competitive.
Or do you not want to open it at all?
Stores, online competition.
Or we just need to wait until new cases are near to zero, or you do not know. These are, as I said, there are many different variations. Pick the one you feel is kind of most familiar.
Virus about, what was the future of retail and can certain retailers survive?
And then I will ask each of our panel members to very
retailers have had to close their
briefly respond to what we're seeing on this panel. Give it a few more seconds, 5,
either 4, just, people have stayed home either through orders or by choice. With
3,
other retailers, 2, Target and a lot of others,
1,
grocers,
thank you.
Who are obviously playing a critical role in our communities by keeping, the food supply going. But it's been tough in a lot of retail. I think you've seen a lot of these headlines about a lot of retailers have
very clear outcome. 61% of respondents are actually saying that we need to open up in a measured and in a regulated way, but we will have to do it with mandatory physical distancing in place. Some of you think that voluntary physical distancing is okay. Very few of you think that we can just do it as soon as possible and not have any major regulation around it. Let's quickly go around the panel. Ron, let me start with you. Surprised? Where do you find yourself? What's your first comment?
We have to move forward cautiously and in a measured way.
A lot of stories, as you said, about toilet paper, and I think everybody's got enough toilet paper by now. But, as a company, we quickly had to start thinking about, as other companies, just what do we do in terms of business travel and work from home, and I think pretty much all companies face that, but as a public-facing retailer,
Matt,
the issues that we were dealing with sort of from the outset is how do we keep our employees safe? How do we keep the people, the customers who come to our stores safe? So we and the other grocers and others who've been staying open, quickly went to extra cleaning, masks.
Well, Fadar, what's your view?
Plexiglass sneeze shields. We've seen social distancing efforts to sort of limit the number of people in our stores to make sure that people can stay distanced. Markings on the floor and signs, and we learned a lot over the last 2 or more months in sort of dealing with this. And part of the thing that we and some of the others who have remained open during this time are thinking about how we can give back to some of those other companies who might be sort of emerging from this a little bit later. And
sure, this has been, in many ways, I'd say that this is an example of where we as humans,
of course, measured and regulated are important. Exactly. George, finally, you first take on this.
Extremely unlikely, but are highly consequential, and we're now experiencing that.
Yeah.
For healthcare, you're talking about demand on the system that was so in excess of our
the ones
normal
who have been open have been thinking about a lot,
and that's
because we've
along
been
every
living under a lot of varying
and
local and state.
so explosive demand. Remember, this is global demand. So that's one of the things that is important.
Yeah, and I think you're exactly right. There's been multiple discussions that's hard for Americans to really deal with, because we don't want the government to regulate.
So I think it's really quite a huge strain
to open up in a responsible way.
Okay,
we can close this poll, and let's go right into sort of the first section where we currently stand. Sectors are being impacted in many different ways, but overall this is definitely going to be one of the worst economic crises that we have seen in the 20th century, certainly since the Depression years. GDP has already collapsed completely. Just what is given now, we probably already
talking about demand that might be on a single day in excess of the demand that we typically see in a month.
Even if things would be normal as of now, it probably
remember global supply chain, so very, very challenging. I think, as you know, the healthcare system and the delivery has also been enormously challenged by having
it's much more likely
the
to
right
go up to the
number
range
of providers,
of
adequate providers,
between 3.5% and 7.5% by the
moment.
end of the year.
We are seeing, as you said, some relief on.
But there are many differences. Some sectors are doing
that. It's still incredibly stressful in parts of the system.
Obviously very badly, particular sectors of the hospitality industry that's been
right now, or that any of the caregivers or suppliers
immediately impacted by the restraints.
But I think we're starting to see increasing coordination, Bart, among the
physical distancing. Some other sectors actually have seen
players in terms of how to navigate this. Greater help from
various
both the government
kind of developments, and actually
state level and federal level on how to help prioritize.
Sector is really important. We all remember that when this started off, that everybody was rushing to the grocery store,
few weeks of this,
and to the supermarkets in order to stock up on everything, including toilet paper. At some point, I guess, toilet paper, you've got enough of it, so there's probably an end to this. Now that we know that this is going to be a longer-term crisis, how have you seen things developing in the retail industry in the past few weeks?
or there's something that you asked specifically, I wanted to make sure I addressed, which is, again, because there have been delays in dealing with other kinds of illness. We may experience some consequences downstream from, of course, some businesses are affected by that, but on a human dimension, obviously, we've got some folks who are dealing with health issues that may have consequences.
So this is a good point. Do you feel at the moment that, you know, now that we're thinking about gradually being to release the measures, that most retailers are kind of ready to protect their customers and their employees? That we've learned so much that we can do this, provided that we obviously do this cautiously and carefully. We thought enough about it to actually move forward.
Yes, and thank you. And I'll go back to something that George said, which is we did not prepare adequately for this. And that's a very important lesson learned, is that for many of us who are involved in infectious disease or public health, clearly this has only been a matter of when. And not if. I think there's been a lot of concern for decades about the potential for such a pandemic, and while some preparedness was done, clearly there was insufficient preparedness, particularly across the many sectors that are represented here today, because a lot of the preparedness.
George, we'll talk a little bit about retail.
And really discuss mostly within the public health or the health sector, and it should be really much more of a multi-sectorial conversation, including the
many other sectors. You've been in
the private sector, the business sector, and so on. I think it's, I mean, there's one important issue that always comes to my mind.
Involved in many different sectors of the economy. A lot of them
is that when people
sort of in the healthcare related
they
industry,
think of healthcare provision or taking care of people who are sick. And there's another segment of what we call the generation.
It's a very interesting industry because there are some parts of
moments like this when you had a pandemic where the
healthcare industry that are doing actually great in this crisis.
Unfortunately, we forget that very rapidly after the crisis is over. But I think that the challenges that public health has faced has been
some parts that are really suffering. Is that an interesting?
Well, I think we have to sort of distinguish some parts of that PPE world. I think many people don't know that things like certain masks, gloves, gowns, these are medical devices. They're actually produced.
There's somebody who's saying, you know, what is happening with all these patients that need
approvals to do that, and so I think what we're going to need to make sure that we're doing is prioritizing things like that. So those medical device PPEs are made available to our caregivers, to those that are on the front lines. We will see a significant expansion of other kinds.
Can you talk a little bit about that sector of the economy and how
that are available, I hope, for the consuming public and for companies that are trying to bring their businesses back online. So I think we're still in a very tight period. I think it's getting better, but I do think prioritizing for the medical community those that are actually medical devices. But I do think Wafa said some important things here in terms of the innovation.
Not the clinics, not the
that we're seeing, and I think we'll see that not just in development vaccines, which, as you know, take time, but possibly a therapeutic at some point which provides a bridge. So to the extent extent that
big
we
effect,
could
that sector as well.
make this virus
So I
less
do think
dangerous
that we
through
should
any
be
kind of
cautious
therapeutic,
and think about more
that
carefully
might
at
help
the
bridge us
healthcare
to
at the moment,
a time where
but
we're
there
going to have
are
a vaccine.
many
So
segments
that and the
are,
innovation that we're seeing from
dealing with
companies, and
such
I know Matt and his
potential, as well
organization
as,
are doing
of course,
these
the
kinds of
whole
things that are what are the things that we can do, innovative things to not only protect our employees but our customers and our guests. So I think it's going to be a tough stretch. I think on the testing side, just real quickly, two things that are critical. One is reliability of testing. I think on the PCR test, we're probably very much there. On the serologic test for antibodies, we're not necessarily there. So we need both. I'm going to say quality and scale, and that's going to take us some time. So
huge. Yeah.
those are the observations I provide there. And my apologies for my screaming dog.
Elective surgeries. Medical conditions, elective surgeries, vaccination of children, numerous. There's numerous public health and healthcare issues.
Yeah. Mm-hmm.
Now? Can you hear me now? Very good. So let's start with the notion that Americans like freedom. They like choice. They like voluntary things. They don't like mandatory things. So we sort of start with that type of DNA in our blood. That being said, we haven't faced something like this.
Sada, there's a question here about, you know, what do you think?
Sure, in terms of our own employees and our
spread that knows no boundaries.
Really haven't waited for
thing as city lines,
you know,
lines,
the overall
lines, or national
team
lines,
safe and the people
it's moving around, and it does require some certainly
I think
the
the
lead
results are actually very illuminating.
on this to our public health expertise.
I do think
allowing
when I
that
think about
others,
it, I have to
just
think
what the
about
healthcare
what
system
the
are going to be.
short
We're basically,
providing that, and
you know,
that's a very important
and
part.
that's really the
CDC, our
the need
national officials need to be listening very carefully.
We've also tried to think about
being given
where some of the
basically typically being in curative health
of seniors
telling us that if we don't get this right, the thing could
we're now moving more into a preventive healthcare kind of system.
So
what
important, the public trust factor, which is really a big part of how we're going to arrest
the population.
and ability
And then
to
if we think about more broadly
follow
in the
some
community,
guidelines that can try to minimize the impact of this. That's right.
How can we help?
kind of major changes and pressures
potential cases.
Important because businesses can open up again.
One of the
And trying to identify them.
But if people don't want to work there, aren't comfortable there, aren't going to shop there, it's not going to have the desired impact of restoring normalcy. So I think there's a role for both the federal government and the state
our
government.
real estate becomes
I absolutely agree that local involvement, local decision making is very important here because different places around the country are going to be impacted differently.
Sometimes federal partners to try.
So that certainly needs to be taken into account. One size
where can we make our property?
So New York is having a totally different experience than maybe a
logistics
very
of that,
rural state that has
some are
much less of impact.
Farther along
But there does need to be
there's
some
been a lot of learning
consistency in standards of understanding of how the contagion
as
operates
we all work out
and what kinds of
I think that's part of the solution certainly.
tools
Needed test, the diagnostic test. How are we going to
and
do that?
equipment need to be distributed. I think that you all heard about the stories about states competing against each other for purchases of equipment. That's inexcusable. I mean, there is a role at this point for the national government to take it upon itself to make sure there are enough supplies, enough equipment, and then to make sure that they use their tools of distribution to get equipment and supplies where they need to be. It doesn't have to be everywhere, but I think that's where the national government does play a very important role of organizing things cost-wise, distribution-wise, using the acts of government to be able to get companies to produce equipment. So we have enough. That's a simple point. So I think those are sort of the areas the federal government can play, but I think a CDC and a national government set of standards that states can apply in their own experiences, I think are the right way to go.
Innovations that are coming up, and we're getting new tests almost every day. I do think then I take something that's a little bit more longer term, and obviously a bit more, actually before I go there, short term would be finding treatment. Obviously they're very sick, this disease is very severe, and unfortunately people who get sick and develop severe symptoms, there is a high mortality. So we really need to identify rapidly potential effective treatments. That's absolutely vital. So we need to test and isolate and quarantine, but we also need to as well find treatments rapidly. I think more longer term, I believe that finding a vaccine will be very, very crucial. But we know that it will take at least a year to a year and a half to find a vaccine, and hopefully we'll be ready. If this virus ends up being a seasonal virus, meaning it comes back next year, then hopefully we'll have a vaccine, an effective and safe vaccine. By that point in time, then we can protect the population. So again, think of it short term and longer term, and but we need to work now on the longer term products that we need to have in hand.
No, actually, not surprised, but interesting. I do think that Dr. El-Sadr will be heartened by these responses. I think one of the questions for us going forward is what are the things that we can do that could alter the equation of the trade-off? So right now, and again, this is a very important reality, which is that we are still learning a tremendous amount, even in the biology of this. So let's assume that over the next couple of months, I'm just using this as a framework, that we begin to learn much more about, that we begin to learn much more about how testing can be improved and scaled, and employers, again, start taking their own actions and working with one another to share best practices on ways of reducing risk. And so it is an equation. I think right now there is a good reason for us to show some caution, given that we are learning in the learning ramp-up phase, and that my hope is that as we start gathering more information, we can start seeing some shifting in what that trade-off looks like. But I think right now we're still really learning a lot. So, go ahead, Bill.
Absolutely. I've mentioned some of those, but some more specific to cleaning. We have enhanced our cleaning procedures throughout the store, and then in particular, the places where consumers might be touching things. So when you walk into a Target store, someone has wiped the cart handle so that you get a nice clean cart handle. When you're checking out, after every customer checks out, the employee is wiping down that checkout area so that, again, we're getting that very, very frequent cleaning. We just feel it's important both for our team, our own employees, as well as the customers, and just giving them the confidence that, it's a clean, safe place to shop. And there's also a number of other ways, everyone is situated differently.
Great to have this discussion. It shows both in very different sectors, the retail and the
pull up in your car and have your products placed in your trunk. You can walk to the front of the store.
Healthcare sector, and we could talk about many other sectors in the economy.
And of course, there's delivery as well. So we try to meet people. Everyone's got a different kind of
how big the challenges are in actually not
given sort of their own particular health and personal situation. So we just want to try to meet people wherever they feel comfortable.
Not just getting through this crisis, but also think beyond. How things will look like once we're beyond this crisis. So it's very interesting. It's also a good transition into our second segment, which really is about how do we get ready to really open up the
in speaking to a lot of businesses,
again, how do we get out of our homes? How will we be
some of the experts in Washington? I still believe that the confidence of the American people in the testing and the understanding of what the risk is really
able to travel again, to go back to work,
and again, government can move ahead or businesses can move ahead. I think businesses are actually being fairly rational.
And I emphasize here again, by responsible we mean
protect, as Matt said, their employees, their reputation, their customers. That's driving them to be very prudent and very, very cautious. There are
need to reduce the probability
that are going to be much more complicated to bring together. I mean, offices may be able to be brought together sooner if people are spread out or they have
COVID-19 occurring
and things like that.
Later on, we'll talk a little bit more about
which we need to be thinking about. But it still has to be guided by the public health and the side of this where the public will believe that the threat to themselves, their families,
how we can make it happen in our own organization.
A lot of people are bought into the fact that the economy could be as drastic as it is right now. If we lose faith and this thing comes back again, it's really going to be very draconian in terms of future impact.
First talk a little bit.
We can't take that chance, I think, is the balance here that has to go forward. So
about
government's the balance that I do go back to what I said before, and I think Dr. El-Sadr agreed, consistency of a message, of a way this is viewed, I think coming out of the national level would be extremely important. I know this has become a bit of a partisan kind of conversation in some places.
What needs to be done.
Serious, conversation and facts and science to be used as best as possible, and then, as things develop, continue.
For that, we have a new poll question that we'll introduce, and after that, I'll ask Dr. Sadar to really follow up a little bit more with that. So the poll question is the following: the most important need on the medical side to suppress new peaks and therefore be able to open up the economy is more testing for possible new cases, more antibody
Was that directed to me?
testing for immunity,
Yeah, sure. No, happy
medication for treatment of mild
cases. That's a balance that the government's always considering.
Because that would help to have people return quicker to work.
People being injured and companies being responsible, using reasonable standards and things like this.
Medication for treatment of severe cases, because that would reduce the pressure on the healthcare sector.
There needs to be some reflection
I now lost
by governments on what kinds of standards are in place.
Right there it is again.
Not to just sort of walk away from the fact that people
development, experimentation, and introduction of a vaccine.
But there
all of the above. So this would be those of you who say we can't open up the economy if we don't do all those five things. None of the above, which means that none of this will really help to suppress new cases, or you do not know.
Whatsoever, and even being rational risk and reasonable risk.
So any of those 4 or 5 options, or all, and all by all you mean that it's a big challenge. We have to do all these things because otherwise we can't get going, because we will not be able to suppress the new cases. So take your time. Make sure which one you sort of, again, of course you want it all to be done, but it's also, there may be a need for prioritization here as well. So we give it a few more seconds. 5, 4, 3, 2, 1, and we'll close it. Okay, so
yes, and
a little bit of a mixed story here.
Important, and I think in the context of a pandemic with a virus that's spread.
Majority is saying it all needs to be done, which is a big challenge.
There's a lot of apprehension, and people are worried.
But there's a group of you who say, well, if we have to make a choice, it's really the testing.
And I feel like having a consistent
for new cases that is most important, or alternative.
is very, very important, exactly.